it looks like people slowed down from the waiting room. So I'll get started quickly. Before I introduce our speaker, I just wanted to remind anyone, if you haven't attended before, that if you do have any questions, you can type them into the Q&A box where we'll see them. And then at the end of Dr. Colbath's talk, we'll review them and ask her some of those questions, the ones that we have time for. And now I'll introduce our speaker, Dr. Aimee Colbath. She's a newer faculty member within the last year, and she is a large animal surgeon. She actually did her undergrad in New York State, so she's definitely lived here before and is familiar with the weather. And she did a bunch of training in Pennsylvania and Kentucky and Massachusetts. She also got her equine residency in Colorado, as well as her PhD. And she's going to be presenting on some of the work that she, that she does clinically, but then also that she researches both for her PhD and then also now at Cornell in her research lab. So she's going to be focusing on regenerative medicine and horses. And I also wanted to mention that she's also an equestrian and has 3 horses at home and just competed in the IRAP with her adorable chestnut. Thanks, Dr. Colbath.
Thanks. Hopefully everyone can hear me well. This is a topic that's near and dear to my heart, both because I am now a director of the Regenerative Medicine Lab here at Cornell. So I actually grow stem cells, process PRP, do IRAP for both our client horses and then also as a service to outside veterinarians. So our local vets or even vets that are farther away can mail us bone marrow to grow stem cells from in the lab. And then because I ride horses that have injuries, just like probably many of your horses have had. So these are 2 of my personal horses that I've evented over the years. So regenerative medicine, the things that we're going to talk about today, first I'll talk a little bit about stem cells, and I'll try to, it's a lot to cover in a short period of time. So I'm going to try to give you an overview of what actually these things are. A general cost for what it costs to get them for your horse, and then some of the conditions that they may be appropriate for. I'm sure there'll be more questions, but it's just a lot to cover in a short period of time. Regenerative medicine is, by definition, the process of replacing or regenerating cells, tissues, or organs. And kind of the classic thing that people may think about is, can I grow an organ in a petri dish? So there has been a group that has grown an ear in a petri dish, and that is, by definition, regenerative medicine. We in equine are oftentimes using these cellular or non-cellular therapies to try to encourage the body to regenerate itself. So it's a little bit different than trying to grow an ear in a petri dish. We're not trying to necessarily replace the tissue of origin with the cells or the substance that we're giving, but we're trying to encourage the body to go through the healing process and regenerate itself. And that is all considered under the umbrella of regenerative medicine. So why do we need it? Well, the top left-hand picture is a picture of a surgery where we have a cartilage defect. And cartilage at this point is very difficult to regrow. And when it regrows, it grows in sort of a fractured pattern as seen in the middle here, instead of the picture on the right, which is what it's supposed to look like. And then in the bottom row, you can see a tendon lesion on ultrasound. When that tendon heals, which is the picture in the middle, it heals disorganized, when it is supposed to look like what this picture is over on the right-hand side of your screen, which is linear fibers. And so regenerative medicine is really used to manipulate the healing process to create tissue more like the tissue of origin. So let's start with stem cells, because they tend to be a pretty hot topic. So stem cells, there's stem cells throughout your body, actually. So we have stem cells in our dental pulp. We have stem cells in our joints. We have stem cells in our intestine. And we've now figured out how to grow those stem cells in the laboratory. The stem cells that you are going to be offered potentially for your horse are mesenchymal stem cells, and they are what's considered multipotent. That means they can become multiple different tissues if encouraged with the right cocktail. So I can take stem cells from your horse, usually from the bone marrow if I'm doing it, and I can grow fat, I can grow cartilage, and I can grow bone from those cells. And I do that by giving them a particular cocktail in the Petri dish to tell them become bone, become cartilage, become fat. These are different than embryonic stem cells. Embryonic stem cells have the ability to grow even more than just classic sort of bone, fat, cartilage. They can grow the reproductive cells, but they carry a lot of sort of ethical considerations around them. So when you're getting stem cells for your horse, you're probably getting what we call mesenchymal stem cells, usually from bone marrow or from fat. So this is an example of us harvesting bone marrow for mesenchymal stem cells. We most often take it from the sternum of the horse. It's interesting, people report that bone marrow harvest is quite uncomfortable, but there was a really great study done by some researchers at Texas A&M. And they found the horse actually reacted more to the administration of a lidocaine block to try to block the site than they did the actual bone marrow draw. So for whatever reason, it doesn't seem to be as painful for horses to have bone marrow draw as it is for people. The horses are just simply sedated for the procedure. The skin is blocked with lidocaine or carbocaine and numbing agent. And then this long needle is inserted into the sternum. It's called a Jamshidi needle. And there's a hole in the center. So we can remove that stylet. We can attach a syringe and we can pull the bone marrow cells out of that. In bone marrow, there is only about 0.01 to 0.001% stem cells. And that's a really important point. So bone marrow is not equivalent to stem cells. There are stem cells in bone marrow, but it's not the same thing to say my horse got stem cells if they simply got bone marrow. And this is important because there's a lot of false advertising done in the human medical space where you'll hear on the radio, come to our clinic downtown and you can get stem cells. Stem cells in the United States for humans are not legal. They're not FDA approved. And so you cannot get stem cells in the US as a human unless you are enrolled in a clinical trial. And so when people are saying, come to our clinic and get stem cells, most of the time what you're actually getting is bone marrow aspirate or some sort of fat deposit layer that has stem cells in it, which I'll talk about next. So culture expanded stem cells are not the same thing as bone marrow aspirate. When I take bone marrow, I then bring it to the lab, I process it, and I have to grow stem cells from that bone marrow for several weeks before I can administer stem cells to the horse. It's a really important point. When we collect bone, when a referring vet collects bone marrow and sends it to our laboratory, they just collect it in the field and they actually ship it on ice overnight to us. So that bone marrow can sit on ice overnight and we can still grow stem cells quite effectively from it. Again, it takes 2 to 3 weeks for laboratory processing so that you can get a pure stem cell population. And we can actually ship those stem cells back to the referring veterinarian either as a frozen product, so what we call cryopreserved, which just means frozen, or as a fresh product for injection. So this is an example how stem cells are obtained from fat. So fat has actually quite a number of stem cells in it. It also has a lot of other things. So if you look down to the left-hand side of the screen here, This is an indication of all the cells that you can find in fat. But there is a portion of stem cells. So again, if a company like VetStem tells you you can get stem cells back, see this advertisement over to the right, you can get stem cells back in 48 to 72 hours. That is not a pure stem cell population. That is a mixture of fat, essentially digested to have stem cells, immune cells, and various other cell types still in it. It's not a pure stem cell population. In order to get a stem cell population, you have to culture expand over 2 to 3 weeks. So that's just to be wary sort of the advertising around stem cells. So there are some differences between cells that are obtained from bone marrow versus fat or adipose tissue. One of those is that there have been several studies that have indicated that bone marrow-derived stem cells have more cartilage capabilities to them. So they form cartilage better than adipose-derived stem cells. And that's important potentially if you're using stem cells for a joint application. So your horse has joint or cartilage disease. So how do stem cells work? Well, they don't grow for us. We're not using them to grow an ear in a dish. We're not using them to grow your cartilage in a dish. We are actually mostly using them for their anti-inflammatory and for what we call their cell signaling effects. So I like to compare them to the action of a conductor. So the conductor is telling the orchestra what to do. Well, these stem cells come in and they try to teach the environment of the joint or the tendon to regenerate. So they're saying, okay, you cartilage cell, chondrocyte, get over here and do your job. That's kind of how we believe stem cells work at this point. We know that they don't stay in the area of damage for very long. So they live probably days to weeks. So they're not replacing the tissue of origin, but they're rather kind of conducting the regenerative process, if you will. So I'll just give you a couple examples of big studies that were done in our lab. Just finished a meta-analysis as well, a big paper analysis that looked at stem cells for superficial digital flexor tendon injury or tendon injury in the horse. So tendon injuries are very common. They are extremely common in racehorses, commonly referred to as a bowed tendon. And these bowed tendons often have areas of loss of fibers, and those show up. If you're looking at the ultrasound on the right here, that's that black hole that is in the middle of that flexor tendon, where we have lost tendon fibers. And tendons don't heal well. Remember the picture I showed you of sort of the disorganized fiber alignment that occurs during tendon healing. They heal with a scar. And that scar is not as strong as the original tendon. And so we are working as veterinarians to give treatments that help that tendon get back to its original strength. And it turns out that stem cells seem to help in that process. So this is a study with 2 years of follow-up, so quite a long follow-up period for a racehorse study. It was using national hunt horses, which are the British equivalent of steeplechase horses. So they're race horses that jump over fences, and also flat horses. And what they found was that stem cell use decreased the re-injury rate. So horses with tendon injuries tend to go back to work, right? They have a return to athletic activity that's quite high no matter what you do. You can rest them and 80% of them go back to work. Sorry, my lights in my office like to turn off because they think I'm not here anymore. So 80% of horses that have tendon injury go back to work, no matter what you do. Doesn't matter what you put in the tendon. Doesn't matter if you just rest the horse. Most horses go back to work. The issue becomes that most horses also re-injure. So re-injury rates for tendon injuries in race horses are upwards of 60%. So they go back to work, they start training, they re-injure. And that's because that tendon tissue is not as healthy when it repairs, when it becomes scar tissue, as the original tissue. What we do know from these large retrospective studies, though, is if we put stem cells in that area of abnormality, that the re-injury rate decreases significantly into the around 20-25%. So that's pretty darn good, actually. And so we don't claim that stem cells will bring your horse back to work faster. That's not what we're after. Not that they'll bring your horse back to work versus rest, because that's not what we're after either. What we're after is a better repair so that your horse doesn't re-injure. There was another study that looked at stem cell use in suspensory ligaments and found a similar result, which is that you got significant improvement in the structure of that suspensory ligament with stem cell application. So the health of the ligament was improved, and the architecture of the ligament was improved when stem cells were given. So that's pretty compelling data. Our lab did a large survey of equine veterinarians that were boarded in large animal surgery or in large animal sports med and rehabilitation, and asked them, when do you use stem cells and how efficacious do you think they are? And this is the perceived efficacy score on the x-axis here. So 1 means not very efficacious. 5 means very efficacious. We really think that they work. Stem cells are highlighted in blue, so that's why they have the yellow arrows pointing to the stem cells. And what we found was that correspondents that use stem cells for ligament lesions and tendon lesions thought that they were very efficacious. So they got a 4 out of 5 or a 5 out of 5 from the respondents that used them for tendon injuries and ligament injuries. So at least our veterinarians that are out there in the field feel that MSCs are really efficacious for both tendon and ligament injury. So what about for joint injury? So what about for that horse that has the large cartilage injury at arthroscopy that doesn't heal well normally? Are stem cells useful for that? Can we get that normal tissue architecture back to the cartilage? Well, there was a study done at Colorado State where they created defects in horses in the cartilage, which is seen over to the right here. So we got that nice, shiny white cartilage. And then we've got that defect created in the cartilage. And they gave the horses stem cells or saline, and they looked at healing. And what they found was that at 30 days, the horses that received stem cells, the cartilage looked much better than those that received saline. But interestingly, at 8 months, there was no difference in the appearance of the lesions. So initially, maybe there was improved healing with stem cells, but by 8 months, it sort of had worked itself out so that there was no difference. That stated, there was an increase in tissue firmness with horses that were treated with stem cells. So the overall sort of theme of this study is that it may be helpful. It looks like there were some advantages to the stem cells, but it certainly wasn't a hit for cartilage healing. Other people have looked at using stem cells for osteoarthritis specifically, and they have used what are called allogeneic stem cells. So allogeneic means not mine, basically. So if I'm giving my horse allogeneic stem cells, that means the stem cells came from a different horse. There is a product in Europe that is allogeneic stem cells that are approved for the use in osteoarthritis. So not in this country, but overseas, you can get allogeneic stem cells to treat your horse's osteoarthritis. And it is a product that is available through Boehringer Ingelheim, which is a major pharmaceutical company. And they have quite a few good efficacy trials for this particular allogeneic stem cell. And the reason that I'm emphasizing that it's allogeneic or not from that horse is that because it is allogeneic, it is available off the shelf. So you get to skip over that 2 to 3 week growth period that you need if you get bone marrow from your own horse. If you use someone else's horse and it's already sort of preserved and saved and ready for shipment out to your horse. The other reason that it's important is that stem cells are reactive or are a reflection of the horse that they come from. So if your horse is sick, its stem cells are not going to be as healthy as a young donor horse that is healthy. And so that's another advantage of using allogeneic cells. The disadvantage is that there is concern that the use of some other horse's cells may trigger an immune response. So obviously we do bone marrow transplants in humans, right? But when a human gets a bone marrow transplant, they get put on immunosuppressive therapy. We do not do that for these horses. We operate, or I guess in Europe, they operate on the assumption that these cells are not going to create an immune response. And they have quite good data behind it, but it's still, I would say, a point of debate among clinicians and researchers. So they may be useful for sure for osteoarthritis. The other thing that there seems to be some good evidence for is their use in meniscal injuries. So horses in their stifle or their knee and their hind leg have a meniscus just like humans do. And they injure that meniscus just like humans do. And there was a pretty compelling retrospective study out of Colorado State by Dora Ferris that suggested that horses that received stem cells and surgery had a much higher return to athletic activity than horses historically that had surgery alone. So if you look at the bottom of that table, the Ferris et al. Surgery plus stem cell group, 5 out of 8 horses, or 62% of horses, returned to athletic activity. Previous surgery only horses from the Cohen group, which was at UPenn, none of those horses returned to athletic activity. And Walmsley's group, 35% of the horses with grade 3 tears returned to athletic activity. So pretty compelling that stem cells may be useful for meniscal injury in the horse. And our lab actually is working on a study right now looking at stem cells for meniscal injury in the horse. So stay tuned on that. What does it cost? Well, harvest of bone marrow, if you do bone marrow cells, is probably about $500. Expansion of the cells will run you about $2,000, and then you've got to inject them. So honestly, the total cost of getting stem cells for your horse is probably somewhere between $2,700 and $3,000, but clearly varies between the practice and the region. And that obviously wouldn't include the lameness exam and the workup. We also are able to store cells. So once your horse has stem cells grown out, we can store them in our liquid nitrogen tank. And we just charge to re-expand them, but not the $2,700 again. It's I think it's around $900 to re-expand them and send them out again. So you can keep those cells for multiple years after they are originally grown. If you're worried your horse may sustain a second injury, then those are available to you. What do they look like when they arrive to you? Well, if they're frozen, they come in these tiny little cryo vials. Your veterinarian draws them up into a syringe and then injects them. If they come fresh, they come also in a vial, but they're not quite this yellow color because the yellow is actually from the cryopreservation media that we store them in. If you get them frozen, you have to warm them rapidly. If you get them fresh, they come cool but not frozen, so you don't have to warm them up. You can't use a needle that's under 20 gauge because you'll shear the cells, you'll damage the cells, and they can't be administered into the joint or into the tendon with any antibiotics or in the same syringe as some of the other medications like HA. Antibiotics damage them, and the stem cells get sort of stuck in the HA, which is a very thick substance. So there are some ground rules to their use in practice for sure. This is that allogeneic product that I talked about that's been approved in the European Union since April 2019. They have quite a good report of adverse effects. So about 4% adverse effects. The majority of those are going to be inflammatory responses or pain responses to injection. That's actually a fairly good rate if you consider other intra-articular therapies and things. But, everything that we do isn't without risk. And you should definitely remember that if you pursue cellular therapies or any other intra-articular or intralesional therapy. You can combine stem cells with shockwave, and you can combine stem cells with laser therapy. So some of the ancillary therapies that we use don't damage the stem cells at all, and they actually may make them a little bit more effective in some cases. What's your clinical take home? Well, stem cells show promise for meniscal injury, certainly. They show promise for some of the tendon injuries that we treat and for cartilage repair. But of course, there's always more work to be done. So I'm going to move on to platelet-rich plasma, which is the other major biologic that's used out there. It's actually the most popular biologic used when we surveyed veterinarians. So about 80% of the veterinarians that we surveyed had used platelet-rich plasma previously in their practice. So you will probably run into this. Platelet-rich plasma is literally platelet concentrate. So you pull blood from the horse and you concentrate the platelets. That's what it is. Interestingly, there are different kits that you can use to concentrate those platelets, and you can concentrate other things with them. So you'll get people that will say white blood cell or leukocyte rich PRP versus white blood cell or leukocyte poor PRP. And that just means when I took that blood and I concentrated the platelets, which are the thing that define PRP, I either brought white blood cells with me or I didn't. That's all that means. And those products, right, PRP with white blood cells in it is probably quite a different product than PRP without white blood cells. And so that makes it a bit confusing when you're reading through the studies and the literature and trying to understand what veterinarians are using out in the field, because one veterinarian's PRP may be very different than another veterinarian's PRP. By definition, all PRP is a concentration of platelets from your horse's own blood. So what does PRP contain? Well, I just told you it might contain white blood cells, and it will contain some. It just varies with the preparation how much. The thing that it contains that we really are excited about in veterinary medicine is growth factors. So think about PRP as the clot in wound healing. So in wound healing, right, you cut yourself and you get a clot. That clot is made of platelets. And that clot has a couple of different responsibilities. One, it stops the bleeding. Great. Two, it starts the healing process. There goes my rib again. And by starting the healing process, it tells all the cells around it, what to do. So it's saying, okay, fibroblast, okay, skin cell, get over here and heal this. And so what we're trying to mimic by collecting platelets and putting it into an injury is this wound healing process. And that's important, right? Because if my horse injures its tendon yesterday, so it's now Tuesday, my horse, wait, is it Tuesday or Wednesday? I can't remember. Anyway, My horse injures its leg on a Monday. I'm not going to put PRP in it on Tuesday. That doesn't make any sense because it already has a clot in there. That clot then dissipates over the first week. And that's when PRP is probably most appropriately put in, not in the first week, after the first week, maybe even into the second week. Because in the first week, my body's already got that clot. It's that I want that healing process to extend. And so then I add the PRP later on in the process. So how do we make PRP? Well, there's several different ways to make it. You can make it with a centrifuge. You can make it actually with these gravity filtration kits, the one that's over to the right here. So you put the blood in the top and the blood goes through a filter and collects in the bottom. This kit on the bottom right, the gravity filtration kit, is going to have a lot more white blood cells in it than the centrifugation kits that are over to the left and up at the top. That said, the gravity filtration kits were pretty popular in the beginning because they were easy to do in the barn aisle, whereas veterinarians didn't want to carry around a centrifuge in their truck. So each kit is different. This is just an example. I did an analysis in my own lab with 4 different kits. And I looked at how much the platelets increased in each kit, how many white blood cells I got, and what the platelet concentration of the blood was before I started. And really, most of the kits will give you around a 2 to 4-fold increase in platelets over what is kind of swimming around in the peripheral blood. So why use PRP? Well, PRP is probably most often used in tendon injury. And there was a great study, an experimental study, which you're always excited when you see placebo-controlled experimental study, because that means there was a comparison to the PRP, and this study in particular was blinded. So the people that were looking at the outcome measures didn't know if the horses received PRP or not. And what they found was in horses that had tendon injuries, if they received PRP, the structure of that tendon was improved over saline. So again, we're not trying to get the horse back to work faster. We are trying to get the tendon to heal stronger. And it did appear to do that in this study. Well, unfortunately, I just indicated that I really like to see placebo-controlled blinded studies because they take away bias. There is a meta-analysis, which basically means a study that looks at all the studies out there that have used PRP. And that study looked at 15 studies individually and kind of looked at an effect. So I'm going to take these 15 studies, I'm going to analyze them statistically, and I'm going to tell you, did PRP help or not? And unfortunately, this paper found that there were no significant differences in the outcomes between PRP and control groups. So according to this meta-analysis, they could not conclude that PRP was helpful. That stated, there was a pretty low quality study design within the studies that they were looking at. So there weren't a lot of those placebo blinded controlled studies that we need. And therefore there was a high risk of bias. So they actually found the less controlled the study, the better the results looked. And we have to be careful when we look into the literature because we need to look at these studies and say, was it placebo-controlled? Was the person blinded? So that we can trust the outcome. I've told you that, but at the same time, when we surveyed veterinarians, because there is laboratory success and then there's real life success, and I appreciate that. When we surveyed veterinarians, the PRP is the red bar. They really felt for tendon and ligament lesions, PRP was quite efficacious. So the majority of people that responded to the survey gave it an efficacy score of 4 or 5, just like you saw with stem cells. So veterinarians out in the field using it feel that it is pretty effective in tendons and ligament disease. How about intra-articular PRP? So giving PRP into a joint, most often for inflammation or osteoarthritis. Well, that efficacy really still needs to be proven. There's very few studies on the use of PRP in a joint. Now, again, I want to say that doesn't mean that it's not effective. It just means that we haven't proven it to be effective. And so we do know that people use it. So again, those graphs at the bottom left where we surveyed veterinarians and we asked them about efficacy scores for acute disease of the joint. People were using PRP, but they didn't quite think it was as efficacious as PRP in tendon and ligament disease. So a lot of the respondents responded with 1, 2, or 3, which would indicate a poor efficacy for articular use. That said, almost 80% of people had said that they used it in joints. So it is being used out there. We just don't have enough evidence behind it to say, is it efficacious or not? Well, I told you PRP is used as sort of a mechanism to increase wound healing. And that may be in a tendon, in a joint, or it may actually be in a wound. So here's a great example. This is actually a cow that I treated, a sanctuary calf that had really bad decubital ulcers, meaning that it had ulceration on its elbows. And that was because of splints that it needed because it had crooked legs. And those elbows became infected. And we had tried all kinds of things. We had tried vacuum-assisted wound healing. We had tried fish skin. We had tried probably every ointment under the sun. And my lab makes these PRP gels, which is pictured over to the right, which is essentially a gel of platelet-rich plasma. And we started using that on November 2nd, as you can see in the upper left-hand picture. And by December 28th, that wound had healed. And on November 2nd, that wound was 90 days old. So it had been 3 months of trying everything we could to try to get it to heal. We couldn't get it to heal. We used these PRP gels and it worked fantastic. So, it's one example of a case, but I do use them for wound healing as well. What about allogeneic products? So I talked about allogeneic products and stem cells, being able to use a different horse's stem cells. Well, you can do that with platelets as well. But there's a product called platelet lysate. And basically that means the cells are removed, the cells are lysed. So they are opened up, the growth factors are spilled out of them, and then we collect those growth factors, but there's no active cells anymore. And you may start seeing that product become available more frequently. There is one company that makes it at this moment, and it actually is known to have some antibacterial effects as well. So we do sometimes use it in joints that are infected. But it's not readily available at this moment, but you may see it in the near future. So I wanted to mention it. What is my clinical take home for PRP? Well, I think it's most effective or proven to be most effective in tendonitis and desmitis, which are tendon disease and ligament disease. More research is needed for joint disease in the horse. And you may see platelet lysate in the future. The cost for PRP is going to run you about $600 to $800. And we can freeze PRP for use later. So that is an option for keeping some. So what about autologous condition serum? This is best known as IRAP. So if you hear someone say, would you like IRAP? They're talking about autologous condition serum. Autologous means mine. So it is my condition serum or your horse's condition serum. That is the opposite of allogeneic. So autologous condition serum. IRAP there's 2 kits that are known fairly well. Orthokine and Arthrex make a kit. IRAP stands for interleukin-1 receptor antagonist protein. That's a mouthful. IRAP basically is a protein that antagonizes inflammation. So we take your horse's blood, we process it for 24 hours. So IRAP, you don't get the same day. You have to wait a day to get it. So that is a little problematic sometimes, right? So that means that your veterinarian has to take the blood, take it home to their laboratory, and bring the product back the next day. Or if your horse comes to us, they need to spend the night or come back another day to have the product injected. But IRAP is a protein that blocks inflammation. There's actually some other stuff in the product too, but that's what it's best known for. The good news is, even though it's not available for 24 hours, it can be stored, and it can be stored for 6 months without significant degradation. And so you don't have to come back the next day. You could come back 5 days from them or a week from that. But it is, not available to your horse that same day. So IRAP is most often used in joints. Interleukin-1 is a very common inflammatory protein in joints and arthritis. And so if we're antagonizing that protein, doing it in a joint makes sense. And this is probably the most pivotal study on IRAP. It's from the Colorado State Group again. And they found a significant decrease in lameness with the use of IRAP. So these horses that had developing arthritis, when they were administered IRAP, had a decrease in lameness. And they were administered 3 doses of IRAP 7 to 10 days apart. So to this day, most veterinarians will administer initially 3 doses of IRAP 10 days apart. Why is that important? Well, if you have to have your veterinarian out 3 times to inject your horse, then there's going to be expense each time. And there is certainly some degree of risk every time you enter a joint. So just keep that in mind as you use IRAP. We still use it a lot. It's a very effective product, but that's some negatives to the product. The other thing to know is some medications end up in IRAP. So if we're taking blood, right? So if your horse is on firocoxib, for example, or Equiox, that Equiox is going to end up in IRAP. And then I'm going to inject it into your horse's joint, and it's going to have Equiox in it. So that is a bit of an issue if you think about IRAP is often used for horses that are competing, that can't have, for example, steroid within 14 or 21 days of a show in the FEI. And so you might choose to use IRAP because it's the horse's own protein. And so it's not going to flag a drug test. But if your horse was receiving drugs when it got its IRAP drawn, then you are giving those drugs back to it. So that's just something to keep in mind. When you're drawing your horse's blood for a biologic product, whatever your horse is on is in that biologic product. The cost, again, is somewhere between $600 and $800, depending on who does it. We often give a series of 3, and it can be stored. And you usually get 4 or 5 doses from one kit. So that's $600 to $800 for 4 or 5 doses. It's going to depend on the horse how much you get. So there's no guarantee. Autologous protein solution is the last one I'll really talk about, and that is ProStride. So I did this on purpose. I talked about PRP, and then I talked about IRAP, and now I'm talking about ProStride. And the reason is that ProStride is essentially a mixture of PRP and IRAP. It's got all the PRP stuff, and it's got all the IRAP stuff, and it's in one syringe. The good news is, unlike IRAP, it can be given to your horse the same day. It takes probably about 30 to 40 minutes to process, and can be injected back into your horse the same day. There's a couple of studies. All the initial studies were all done at Ohio State or the Ohio State University. The first one that is the pivotal study is that 40 horses were treated for arthritis, and those horses that received ProStride significantly improved their lameness by 14 days. So that's great. So within 2 weeks, their lameness was improved. if they were administered ProStride. How does it work? Well, it increases the IRAP, so that's why it's like IRAP, and it also has the components of PRP, namely the growth factors that I talked about. So really interesting, kind of cool therapy. We have it here at Cornell. Clinical relevance. Well, there's not many studies on it yet because it's fairly new within the last 7 to 10 years, probably 5 to 7 years, actually. But I think there is some clinical relevance, which is that both autologous conditioned serum, or IRAP, and autologous protein solution, also known as ProStride, are legitimate alternatives to steroids for joint disease. So most veterinarians, IRAP is pictured in the pink, ProStride is pictured as purple, are using this as a joint therapy. So they're giving it an efficacy score of 4 or 5. There's not currently any evidence for utility of ProStride, at least in tendon and ligament disease, nor IRAP. So we don't tend to use them in tendons and ligaments, but we do use it quite a bit in joints. Remember that any drugs that your horse is on is going to be reflected in that product, either IRAP or ProStride. ProStride in and of itself is $800 to $900, and you get 1 dose for 1 joint normally. Sometimes we can split it if it's a small joint. So something like the hock joints, you can split the ProStride, but normally it's 1 dose. So that's a little bit different than IRAP. So I told you got 4 or 5 doses of IRAP for $800. You get 1 from the ProStride kit. So it is a little bit more expensive. I'm going to briefly touch on 2 more things in the last 5 minutes. One is alpha-2 macroglobulin. So alpha-2M has become relatively popular due to some really good advertising by the company. It is also a blood product where you draw the horse's blood. It is autologous, so you get your own horse's A2M. And essentially the centrifuge, which is actually the same centrifuge that's used by ProStride, isolates this alpha-2 macroglobulin, which is a large protein. It's a very heavy protein. So basically when you do the spin process, all you tend to get is albumin and alpha-2M out. There are murine or mouse studies that indicate its possible efficacy in arthritis. There are currently no efficacy studies in horses. So there's a lot of anecdotal reports of, a veterinarian or an owner saying this worked for my horse. But there is not a placebo-blinded controlled study for efficacy. There is one study out of Oklahoma State that indicates that there were no adverse or negative effects associated with its administration in a population of horses, but they did not look at the efficacy of the product. And I personally met with this company. We have this product here at Cornell. And they're interested in doing some research, but they know that they haven't put that research forward for us just yet. The alpha-2M, you will either get 15 mils or 30 mils. That's part of the reason owners like it and veterinarians like it. And the average dose for each site is listed here. So if I'm doing a stifle, most people will use 8 mils. So I will get multiple doses from that $800 to $1,000 kit of alpha-2M. So the safety study indicates that it appears safe, that there aren't large adverse effects. But again, there is no efficacy work performed in horses whatsoever. So the cost is $800 to $1,000 per kit. You get multiple doses out of the kit. It is most often used in joints, but we can't say whether it's effective or not. I'm going to mention one more product in the last 2 minutes, which is Renovo. So Renovo is a placental allogeneic product, meaning that it's not from your horse, it's from a different horse, and it's from a placenta. And it's an amniotic tissue that is cryopreserved and then maintained frozen. It has no cells in it, and it is shipped to you frozen for use, or shipped to your veterinarian for use. They advertise it as effective in joints or as effective in tendons and ligaments. I do not use this product here at Cornell. But there are veterinarians in the area that use it, I'm sure. It is another product where there is actually no efficacy or safety studies performed by the company in the peer-reviewed literature. So there is no evidence that it is efficacious. There is also no evidence that it is not harmful. But there's a lot of anecdotal reports of success, certainly by veterinarians and by owners. I choose not to use this product until they at least put out a safety study. And the reason is that it sets me up for liability, certainly if I'm using a product that isn't proven to be safe. So if you have any questions, there go my lights again, so we must be done. Here is my email address, and I'm happy to open up to questions now in the chat.
Thank you very much, Dr. Colbath. It looks like you're still in the dark.
I'm sorry, let me get that.
There you go.
My room gives up on me every now and then. It's really frustrating when I'm doing a lot of work and it just keeps shutting off, and I'm like,
we've had other speakers.
I should get up and move.
Same problem. Yep. There are some good questions. So the first one is an interesting question. So they have a question about ProStride. They had heard that the ProStride might have a texture or like granules in it, which could be irritants. And so they're wondering, is that true? And are there cons associated with that if it is true?
Oh, it's a good question. So it has not granules in it, but it actually has cells in it. So it's just like PRP. And so the first step is, there are two steps to the process of isolating ProStride. The first one, you draw blood, it goes into the centrifuge or the spinner, and you concentrate those platelets. So you're essentially getting PRP. And then the second step is a desiccation step where you concentrate the growth factors as well. And so you concentrate the IRAP. And so I don't know, it's no more irritating, I would say, than PRP would be, and it is your horse's own product. But I will say any biologic that we give, anytime we enter a joint or we enter a tendon or a ligament, there is certainly a risk of irritating that area. But that risk is actually true if you use non-cellular products too. So back in the day that we injected Adequan into joints, the rate of inflammation after Adequan injection was right up around 11%. So anytime that you use a product, you have a risk of inflammation. But I would say there's no evidence that ProStride has any more than any other biologic or other product.
Okay, great. And so do you know anything about the source of Renovo? Where are they getting the placentas or anything like that?
It's a good question. I do not know. The company doesn't give you a ton of information. And if you actually go to their website, I haven't done this in probably a year, but there's like really tiny print at the bottom that says, we don't claim that this product is efficacious, because they have to have that tiny print.
Sure. Yeah.
So I do not know.
Okay. Yeah. And Emily, maybe if you could clarify your question. She's asking, is there an age component associated with the efficacy of stem cell therapy? I'm not sure if she means age of horses or age of the stem cells.
There is an age of donor. So we know that young stem cells are better at releasing growth factors and other pro-healing factors than old stem cells. So the stem cells of a 20-year-old horse are not nearly as good, if you will, as the stem cells of a 2-year-old horse, which is some of the reason that people have really pushed for allogeneic stem cell use. So getting these young, healthy donors. We know that that's actually true for the other biologics too. So there was a really cool study that looked at horses that were hospitalized for surgery and taking IRAP from those horses prior to surgery. So like prior to you stressing them out versus after surgery. And the IRAP is in a much lower concentration after surgery versus before surgery. So if you are going to do a biologic, we try to draw it before we stress the horse out at the hospital.
It's worth keeping in mind. Interesting. And I don't know if you would know this. Someone's asking if there's any efficacy studies or if anyone's looked at, sorry, the question just disappeared. If any of these therapies work on horses with ECVM or equine complex vertebral malformation.
No, it's a really great question. So I actually just finished a review on neurologic disease and the use of regenerative medicine, weirdly enough. So all the literature is sort of fresh in my mind. There's not any evidence yet on efficacy either so dogs get the same type of disease as well, either in dogs or in horses, clinically speaking. There have been quite a few studies that have looked at its administration into the cerebral spinal fluid, and it doesn't seem to have an adverse effect. So many times these studies are done so that the first step is it going to harm anything? And then the second step is, are we actually going to help anything? And I think we found that it's not going to harm anything. And so now people are moving forward with is it going to help? The tricky part about like Wobbler's disease, for example, is that it's not one insult. It's a constant insult. And so you can decrease the inflammation for a short period of time, but it's constantly rubbing the spinal cord. So it's hard to, without surgical intervention, then stop that from happening.
Right. Yeah, more of a stopgap almost, right?
Yeah.
And then there were a couple of related questions. It seems like the theme was basically how often would you repeat these? It would vary, of course, quite a bit depending on the problem, but
yeah, it depends a lot on disease. The ProStride, the initial studies on arthritis, the efficacy seemed to last in the 4 to 6 month range, which is why I kind of really pushed to get the therapy here for that reason. IRAP, again, we use it at 3 injections at 7 to 10 days usually, and then people will often repeat those injections every few months. But it, again, is going to depend on the condition. If your horse has early osteoarthritis, you're going to get a longer period of time. If it's got advanced arthritis, you're going to get a shorter period. I think, and I should have emphasized this, and I apologize for not, I think where these therapies are really helpful is in early disease when you really are trying for healing in the joint, right? Like in a horse that has advanced arthritis, there's not, you can use a steroid in that horse because you want a potent anti-inflammatory. But the truth of steroids is there's no evidence that the steroids are going to help healing. Like they're just there to make you feel better. And so if you're in a situation where you've recently had surgery or you've got early disease, an early traumatic event, or potentially if your horse has metabolic syndrome, right, and shouldn't be having steroids, then these therapies are very helpful. Then these therapies are super helpful. But in the late stage joint, it's not, they're not necessarily what we reach for.
Okay, awesome. And I know you had to leave right at 7, so thank you very much, Dr. Colbath. If anyone has questions lingering or you think of any afterwards, Dr. Colbath included her contact on that last slide. You can also reach out to us. Vanessa sends out that monthly email. And I just wanted to announce that we've decided on our February speaker. It will be our very own Callum Donnelly, who's also here tonight, and he'll be speaking on, there he is, on a reproduction topic in horses. So stay tuned and we'll send that out shortly. And again, thank you very much, Dr. Colbath.
That's great. Thank you guys. Back to work for me.
Yeah.
See you later.
Bye, everyone. Thank you for joining us.